COVID-19 cases are rising once again across the country, and a lot of people are trying to take extra precautions heading into this upcoming holiday. Dr. Mark Callery is a physician at Utica Park Clinic in Owasso, and we've invited him to join to talk a little bit about what to do if you're traveling and you should be exposed to COVID, or, you know, how do you handle being sick on the road? Welcome. Thanks for being here.
Thank you for having me.
This stemmed because my mom was traveling recently and got COVID and kind of was trapped in another town for a week. How do you prepare for something like that?
Yeah, so there's a few things you can do when you're going to be traveling, and some of it depends, of course, on where you're going and what you're going to be doing, who you're going to be with. For example, if you're going somewhere where you're going to be with family and friends and places you can stay, you may not need to take a thermometer or some of those things. But if you're going to go on a cruise ship where you want to have access to those things, then there may be more things you take. I think one of the most important things is having some test kits available. Mm-hmm. You know, you can get those free through the government, and having a few of those on your hand, that if you start to have symptoms, you start to get worried, you know, go ahead and have that test done and have a better idea of if that's what it is you're dealing with.
Right, because then if you test negative but you still have these symptoms, they're very similar to the flu. That's kind of the tricky part about this.
That's exactly right, and we're seeing a lot of flu going around right now too, which has been different from years past. And you know, if you have a fever and a cough, it's going to be real hard to tell which one's which without having some testing or having access to health care for that.
So oftentimes, if you test positive with COVID, now kind of protocol is taking Paxlovid?
Yes, so Paxlovid is definitely the main treatment right now. It is an antiviral. It has to be started within 5 days of getting sick, and so having access to that is key. And if you're going out of the country or somewhere where you may not have access to health care, it's not a bad idea to talk to your doctor about would it be a smart thing to have some of that on hand just in case.
When we talk about these symptoms, how debilitating are you? I mean, the people that are coming to the hospital these days?
Yeah, so we're seeing a mix right now. We're seeing a lot more people that just have very mild symptoms, that are just having, cold and congestion, drainage, those kind of things. But there are definitely still people getting sick. We still have a significant amount of people getting hospitalized and having some bad symptoms.
How does the booster benefit, though, in the long run for these patients?
Yeah, so the booster and just being vaccinated in general is important. Making sure you've gone through that, gotten that done. The newer booster, that's the bivalent, certainly gives some added protection that the older one didn't, and so staying up to date on those is a key part of it.
Mm-hmm. Any last-minute suggestions or tips as people are planning their holidays? Because we all want to be together, but and so that pull from pandemic,
Right.
it's like, I'm going to do this, and maybe just kind of risk it. Yeah. Especially because a lot of times we're with our seniors and our families.
That's exactly right. I think that's what's important. It's to be smart and think about the people that you're around, right? I mean, you can deal with the symptoms yourself, but you don't want to get those family members sick that may be more at risk for a bad outcome if they do get sick. So being smart, washing your hands, using hand gel, even if you're in your people's houses, just doing the things that we know we should be doing.
Common sense can go a long way.
That's right.
All right. Thank you. It was great to meet you. Appreciate you coming in early for us this morning.